So my name is Ester Owelle, and I'm a lab manager at Busara Center for Behavioral Economics. So Busara is headquartered in Nairobi, and we have offices in Africa and India. And Busara is a research and advisory firm that is dedicated to applying behavioral science in the global south. So Busara has two arms, that's the research arm and the advisory arm. And for me as a lab manager, I sit in the research arm, which mostly, and my role basically entails working with researchers in the global south on their experiments, field research experiments, and also lab experiments that we do across different sectors. So I work closely with academic researchers in various sectors across the world in their design and execution of projects, and maybe in the implementation of the projects here in Kenya. So, and one thing that I'm really passionate about is that I'm passionate about using evidence approach and behavioral science to inform policies and to alleviate poverty, which ties very well in my role here at Busara as a labs manager.
How did you discover the Evidence in Governance and Politics network, and what has your experience been?
First, I think there was an application about being a learning participant in Benin, which I applied for, and I got accepted and now joined it. So after that, I think there was also a refresher training that we did last year in December. So in the refresher training, we talked about, so there was also need to do some refresher about experimental methods. So I joined that refresher training, and through that training, they gave us they talked about a grant that was being offered, and this is now the EGAP small grant, and I gained some interest in that. So I also applied for that. And after applying for it, I worked with EGAP members and through a mentorship program who really supported me in the research, in this research that I did.
How did that research project occur to you? What was the need? Why did you feel it was important?
So the research is on the effect of source of information on compliance of public health measures in response to COVID, with particular interest in urban slums, which is informal settlements here in Kenya. So we see that people living in informal settlements have a greater risk of being affected by COVID-19. And this is due to public health concerns, such as lack of basic needs, such as water, housing, soap, and even difficulty in social distancing because of overcrowding. So I see there's need for policymakers to understand the context of the environment in informal settlements from the communities themselves before imposing any strategies on them. So I believe having an in-depth and prior understanding of this will increase compliance of public health measures in the community, since their social and environmental factors will have been catered for. So 1 to 10 months, they'll receive an audio recording of a respectable community leader with public health measures to adhere to, and the other treatment will receive the same message, the same content of the message, but via a text message. So I'm going to be looking at and I'll be comparing this to a control group, will not receive any treatment, and we're going to see to determine the causal impact of this intervention.
So you'll look at COVID infection rates, but it looks like you're also trying to measure other types of compliance. Like, are you going to be monitoring whether people wear masks or not, or whether they socially distance, or what are you able to observe?
Public health measures compliance, basically. Like, are we also seeing that through this, there's less overcrowding? Are we seeing that people are now wearing more masks? Are people now even complying to the public health measures that were put in place? Yeah.
And for the treatments, it seems like the main difference is one is a little bit more personable, right? It's someone or you're familiar with, a community leader, you hear her voice or his voice, and the other one is just a text message. So I guess I would have the hypothesis that the audio version is going to be more effective. Also because of literacy rates, that would be my hypothesis. Does that sound like a fair hypothesis to you?
Yes, yeah, so that's my hypothesis as well. But again, with research, you might hypothesize something, but the data comes in and you're like, okay, so this is what you hypothesize, but it comes out different. But that is basically what I hypothesize in this research, that the treatment with the personal effect of people, knowing that this is someone that they know, this is a community leader that is respected, will have more effect.
How does this research study relate to other types of research that you would like to do in the future? Does this contribute to a larger research agenda that you have?
I'm trying to get knowledge about something that is in informal settlements, and I believe that through this knowledge, you can be able to have now a large scale study, because I'm also collecting other outcomes effects. There's also something to do with health outcomes. I'm also collecting data on food security outcomes, So I believe that through this, I'll be able to do a bigger research and trying to see what effects do such pandemics have and what factors can we change, like what factors should people consider, and also policymakers, what should they tap into when they're thinking about when you have future pandemics or when you have like any future disruptions in the country.
That's great. That's exciting. And one final question is, what advice do you have to funders like the Hewlett Foundation that fund governance research?
For the funders, I'll talk mostly about, I'll be biased on Africa and particularly Kenya, because I'm here in Kenya. So in Kenya, currently we are under the federal system, which is a devolved government. And we see these a lot of challenges that we're currently seeing, a lot of governance challenges that we still are facing. That is in corruption, cases are still high. We have unemployment, we have negative ethnicity, poverty, high cost of living, and this mostly affects low-income earners in Kenya. So I think this is one of those. These are some of the areas that we'll want to do more research on and more donor funding coming in. And I think and even before the donor funding comes in, I think it's very, very important that we understand the social economic context of these areas before even implementation. So one gap that I normally see sometimes is that you do a research in the West and you want to replicate it in maybe a setting in developing country setting, for example, in Kenya, but the context is totally different. So I'll say like more resources should be tapped into understanding the context before doing the implementation. And these are some of the areas that we'll want to see more donor funding coming in, and this will have a high impact on the Kenya and also particularly the low income earners. So these are some of the things that I'll want to see like some more donor funding coming in.
How can funders do that practically? How can we better understand the local context to fund research that's designed around the local context and doesn't just replicate something that's been done elsewhere?
Yeah, so I think one area, and over time we are seeing increasing collaboration between local researchers and the global community. So I think we should have more partnerships and local collaborations between African researchers and also the global community. So through these collaborations, we'll find that we have this, the person in the particular country, the local researcher understands more of the context, and they're able to work together with now maybe a research from the other global community. So more collaborations and partnerships should come in. And if we see this, I think we'll be able to understand more of the context through this.